Hello, my name is Kaylee Schaefer, and this is my pathophysiology presentation on multiple sclerosis. So to begin, I'm just going to start with a really simple definition of multiple sclerosis. It's also known as MS, which is how I will refer to it throughout the rest of the presentation. So MS is a disease in which the immune system eats away at the protective covering of nerves, and it is classified as an autoimmune disease, and it is chronic. So on the right here, I have a little picture that shows a healthy nerve versus a nerve affected by MS. And as you can see in the picture, the myelin is damaged and it exposes the nerve fiber, which is what causes the signs and symptoms that we see in patients with this disease. So let's get into the classifications. There are four main classifications of MS, and they are classified based on how they affect the person with the disease. So the first type is known as relapsing remitting MS, or RRMS. This is the most common type of MS, and it is classified by periods of attacks or relapses, which are known as flare-ups, followed by periods of remission. So the person will go through a flare-up where their symptoms are much more worse than they usually are and very bad, and then they will have a period of remission where they feel really good and aren't really affected as much by the disease as normal. And then the second type is called primary progressive MS, or PPMS, and this is when the symptoms worsen steadily from the onset of the disease with little to no periods of remission. So whenever the person is diagnosed, their symptoms will continue to worsen and they will have little to no periods of feeling better. And then the third type is known as secondary progressive MS, or SPMS. This type looks very similar to RRMS in the beginning with periods of relapsing and remission, but it eventually progresses into a steady decline in function with or without occasional relapses. So the person will have a steady decline in motor function and cognitive function, and they may or may not have relapses where they feel even worse. And then the last type is the least common type of MS, and this is called progressive relapsing MS. And this is worsening of symptoms from the onset of the disease with periods of relapses or flare-ups. So the symptoms will continue to worsen over time, and you will still have periods of flare-ups where the symptoms are even worse than they are for you on a normal basis. So next we're going to get into the pathophysiology of MS. So I'm starting by kind of explaining more about MS and what it is. So MS primarily affects the central nervous system in people, and this involves many areas, including the cortical gray matter, the periventricular and juxtacortical white matter, optic nerves, spinal cord, cerebellum, meninges, and more. It mainly affects the brain and the spinal cord of the patients who have this disease. There are two separate parts of the pathophysiology and what causes the signs and the symptoms that we see. So the first part is focal inflammation and neurodegeneration. This causes lesions to form on the brain and the spinal cord of the patient. So as we can see here, this is a picture of a brain with someone who has MS. It's an MRI scan, and you can see the white dots all over the brain. These are called lesions, and they're due to the inflammation and neurodegeneration, and they cause a lot of the signs and symptoms that we see along with the nerve damage. And the second part is that the body's immune system mistakenly attacks the myelin sheath, which is a protective covering on the nerve cells, and it does this in the brain and the spinal cord, which leads to inflammation, demyelination, and axonal damage. And you can see here a little up-close picture. We have a normal nerve cell on the top, and then on the bottom a nerve affected by MS. The myelin, which is the yellow part, is all damaged and broken, which exposes the nerve fiber, which leads to a lot of pain for patients and inflammation and many of the symptoms that we see that comes with MS. Next, we're going to get into the causes and risk factors. So the causes of multiple sclerosis are still unknown. It is unclear as to why MS develops in some people and not in others. It is thought that it is a combination of genetics and environmental factors that lead to the diagnosis of the disease in people. But there are several risk factors that can indicate that you have a higher chance of developing multiple sclerosis. So age is one of them. MS usually occurs between 20 to 40 years old in people. Sex, women are 2 to 3 times more likely than men to have multiple sclerosis. Family history, if one of your parents or siblings has MS, you are at a higher risk of developing the disease. Infection, certain infections have been linked to MS, and this includes the Epstein-Barr, which is the virus that causes mononucleosis. If you have had this infection before, you have a higher risk at developing MS in the future. Race, people of Northern European descent have the highest risk of developing MS. This one is pretty interesting, but the climate can affect the chances of having MS. It is a lot more common in places with temperature climates such as Canada, Northern United States, New Zealand, Southeastern Asia, and Europe. Vitamin D is another big part of MS. If you have low levels of vitamin D and low levels to sunlight exposure, you may have a higher risk of getting MS. And this is also has to do with your birth month, because if your mother did not receive a lot of sunlight while she was pregnant with you, this can increase your risk of having MS. People who are obese or were obese in childhood have an increased risk of developing MS. People who smoke have a higher risk of developing MS. And then this one is pretty interesting, but people with MS have a different gut microbiome than people who do not. And there's not much known about this at the time, but it could also be a risk factor because the gut microbiome is different. And then signs and symptoms of MS. MS can vary greatly from person to person. The symptoms can look completely different from one person to another. But the most common symptoms I have listed here, there's a lot of symptoms, and people with MS can sometimes struggle with daily tasks because of this long list of symptoms, and it can be very difficult for them to do a lot of daily tasks and just be able to do things that normal people like to do, and they can't because of all of these symptoms. So these are the most common treatments for MS. Corticosteroids reduce nerve inflammation. Plasma exchanges can help with the progression of the disease. Interferon beta medicines, they interfere with diseases that attack the body, which can also decrease inflammation and actually increase nerve growth. Therapy, physical or occupational therapy, can help with performing daily tasks and mobility. And then muscle relaxants can help with muscle stiffness and muscle spasms from the disease. And then one of the newer treatment options that I have been looking into and doing a lot of research on, because my mother has MS, so it is very interesting to see new ways that she can be helped. Stem cell therapy is new and currently being researched as a treatment option for MS. The stem cell is a single cell that can replicate itself or differentiate into many different cell types, and these may be able to be used to create new healthy nerve cells to replace the damaged ones from the disease. And stem cell therapy could possibly greatly reduce progression of multiple sclerosis and make symptoms a lot more manageable, but it is still being researched and there's not much known about it for MS at the time. Here are my references, and then at the end I just have 3 questions that are some really common questions that people have about MS. So one of them is multiple sclerosis hereditary? And there is not a lot known about this yet because, like I said, MS is still being researched and there is not a lot known about how the disease works yet. They know that it's not directly inherited, but there is a genetic component to it. So you are not certain to get it if your parent has it, but you are at a higher risk if someone in your family has it than someone who does not have a history of it in their family. Why is there no cure for multiple sclerosis? Well, it is a chronic progressive inflammatory disease and the cause is still unknown. It's a very complex disease, and since there is no known cause, it makes it very difficult to find a cure. The main focus is slowing progression and managing symptoms. And lastly, how is multiple sclerosis diagnosed? There is not one single test that is used to determine if someone has MS. It is a combination of a lot of different things like clinical assessment, medical history, physical and neurological exams, and imaging tests such as MRIs. MRIs can show that the lesions on the brain or spinal cord, which is a very common sign of MS. Spinal taps can be done, but mainly diagnosis is focused on lesions in multiple areas of the central nervous system like like the brain and spinal cord that have occurred at different points in time.